This was a recently published meta-analysis which clumped basically all the different studies looking at outcomes of mothers who had gestational diabetes in the pregnancy. What I want you to focus is on this number here. A woman who has had gestational diabetes in a pregnancy has a 4-fold higher risk of developing type 2 diabetes than a mother who does not have gestational diabetes. And this is looking again at different populations, different ages, different times of follow-up. So if mothers are at risk of developing type 2 diabetes after they develop GDM, how long after they have gestational diabetes do they develop type 2 diabetes? Well, this was a nice study performed by Dr. Kim, published in Diabetes Care in 2002, that looked at that exact question and looked at different ethnicities. And what they found was that if you look at length of follow-up after delivery, the key time when women develop type 2 diabetes following gestational diabetes is in the first 5 years. But the effect continues up to 10 years. So the key time to screen women for type 2 diabetes after delivery is in the first 5 years after that delivery. And that can be, there's different ethnic variation to this, but it seemed to hold true for the whole population as a whole. So again, we come back to the circle of diabetes appears to beget diabetes. And again, we'll talk about interventions to prevent type 2 diabetes in our next section. So how do we modify these risks? Before we go on to a discussion of how we are going to modify these risks, let's talk about the definitions again, just so that we have them in our mind for the discussion. So again, the ADA recommends that prediabetes be diagnosed if the A1C is 5.7 to 6.4%, or if there's an impaired fasting plasma glucose of about 100 to 125, or a 2-hour value of 140 to 199. And of course, type 2 diabetes is diagnosed if there's an A1C of 6.5 or above, or a 2-hour value of greater than 200, or a fasting of greater than or equal to 126. The most important thing that I can tell you is that we need to bring mothers in for postpartum screening. And I know that this is a very rate-limiting step, if you will, if we're seeking to prevent the development of type 2 diabetes, because it's very, very hard to bring women back at 6 weeks postpartum to have a fasting 75 gram to our GTT. At UCSD, we have our diabetic educators contact the patients to remind them, and we also have an electronic medical record where we're able to put in the order for the 75 gram 2-hour GTT so that it doesn't get missed by the provider who's seeing the patient at 6 weeks postpartum. But even with all of these reminders and facilitation for the providers, our postpartum screening rate is still quite low. I think we increased it to about 60%, but that's as high as we've been able to obtain. But I can't emphasize enough that we need more research and more work to try to understand why women don't come in for their 6 weeks postpartum and how to encourage them to do so, because that's going to lead us to a triage, to triage the patient into the proper resources and counsel her in the proper way regarding her risk of developing type 2 diabetes later in life. So we've talked about breastfeeding and the benefits earlier. Let's talk about it in a lot more detail. As we discussed earlier, pregnancy is characterized by insulin resistance. I didn't mention this earlier, but it also is characterized by elevations in fasting triglycerides. Breastfeeding, on the other hand, we know does cause changes in the maternal metabolism such that we see that women need to use about 400 to 500 kilocalories per 24 hours of additional calories. They also utilize about 50 grams of glucose in 24 hours to produce milk for lactogenesis. So all of that leads to improved insulin sensitivity, as you can imagine, weight loss. There's also increased mobilization of fat stores in the mother, and this leads to decrease in the lipids of the mother. So all in all, it leads to lower rates in metabolic syndrome, particularly among women who had gestational diabetes. So again, I want to bring you back to some studies that have been performed. This was a very elegant study performed by Dr. Gunderson looking at breastfeeding and the effect of duration of breastfeeding on maternal long-term outcomes. And this was done in women who had gestational diabetes. This was called the CARTA study. And I know this is a complicated slide, but I just want to point out that on the y-axis is the hazard ratio for the development of metabolic syndrome. And on the x-axis is the duration of lactation. And as you can see, it's 0 to 1, 1 to 5 months, greater than 5 months, and greater than 9 months. And as you can see, there was a decrease in the hazard rate for the development of metabolic syndrome among women who breastfed, particularly those who breastfed for over 9 months. But the effect could be seen even with 1 to 3 months of breastfeeding. And Dr. Gunderson measured BMI, looked at race, socioeconomic status, parity, lifestyle behaviors, and weight gain during the duration of this trial. And women were followed for 20 years, and they were evaluated for the development of metabolic syndrome at the initiation of the trial and then 20 years later. And so to summarize her findings, she found that metabolic syndrome was 44 to 86% lower among women who breastfed and had gestational diabetes. So again, very powerful information to give to your patients that just by breastfeeding, you can decrease your risk of developing metabolic syndrome. This was also seen, by the way, in normal pregnancies. The effect was more pronounced in those pregnancies that had gestational diabetes, but it could also be seen in normal pregnancies, and there's a dose response. In other words, the more you breastfeed, the better it appears to be for the mother. Now, you all know the benefits of breastfeeding for the child as well, but this was another interesting study done by Dr. Schaefer. And what she looked at was that in 324 children whose mothers had gestational diabetes, and these were children aged 2 to 8, she looked at the prevalence of childhood obesity, or what we call overweight. So that's in the y-axis here is the percentage of overweight, and in the x-axis you have for the total cohort those of normal weight mothers, and those are children born to obese mothers. And as you can see, with breastfeeding, you can see a lower rate of childhood overweight, particularly in the mothers who had obesity themselves. And as you can see here in the black is never breastfed, in the gray is breastfed for 1 to 3 months, and in the white, breastfed more than 3 months. So just with 3 months of breastfeeding, you saw this marked decrease in the rate of childhood overweight. So there's many other reasons to breastfeed, but this is powerful information to give to your patients. Now, what does the American Diabetes Association recommend to prevent the onset of type 2 diabetes in patients who have had gestational diabetes or who are diagnosed with impaired glucose tolerance, impaired fasting plasma glucose, or prediabetes? Well, this is taken exactly from their website, and what you can see is that they recommend weight loss of about 7%. They recommend increased physical activity, moderate exercise for about 2.5 hours per week. They also recommend counseling. Being counseled about weight loss and increase in physical activity appears to be a better model than just saying it at a clinic visit. They also recommend considering metformin in women who have a BMI of greater than 35, are younger than 60 years of age, and had prior GDM, which is our target population. And they also recommend annual screening for type 2 diabetes. On some areas in their website, they recommend every 2 years, but in this group of patients, they recommend annual screening, as well as screening and treatment for things like hypertension and high cholesterol. And I just noted here the website on the CDC where you can get some important tools to counsel your patient and to give to your patient to try to achieve the goals that the American Diabetes Association recommends. And does lifestyle modification work? And the answer is yes, it does. These are 3 very large trials that have recently been published. The first was the Daking trial, which was done in China, and it involved 110,000 patients who were randomized to diet, exercise, or both. And they were followed for 6 years, every 2 years. And what they saw was that there was a 46% reduction in the development of type 2 diabetes with lifestyle modification alone. The second trial is the Finnish Diabetes Prevention Study Group trial. They followed the patients for 7 years, and they included 522 subjects, and they were randomized to either diet or diet and exercise. And what they found again with lifestyle modification was a 43% reduction in the development of type 2 diabetes. And the last trial is the Diabetes Prevention and Program Research Trial, which was here in the United States. And that trial, they wanted to achieve and maintain a weight loss of about 7%. That's where that 7% weight loss comes from. And they instructed the patients to do 150 minutes or more of exercise per week. And again, they saw a 34% reduction in the risk of type 2 diabetes with just those interventions alone. And lifestyle intervention appears to have a long-lasting effect. While most drug trials do not show that, once you stop a medication, usually the risk of type 2 diabetes goes back up. But with lifestyle modification, that risk reduction actually continues. So very powerful information that lifestyle modification does play a role. Well, what about in our patients with gestational diabetes? This was a secondary analysis of that big trial I spoke to you about that was performed here in the United States. And what they did was a sub-analysis, and they looked at 350 women who had gestational diabetes and compared them to controls. They randomized women to placebo or lifestyle intervention. Placebo, lifestyle intervention, and metformin. And they started the metformin about 850 milligrams daily. And they followed the women for 12 years. What they noted was, as you can look at the table here, with lifestyle intervention alone, there was a lower rate in the development of type 2 diabetes. The incidence was decreased by as much as 50% with just lifestyle intervention, such that only 6 women needed to be treated with lifestyle intervention in order to prevent a case of type 2 diabetes in 3 years. That's a very low number. It's very hard to achieve those kinds of numbers in any other trial. Now, what about just metformin? Well, metformin was very comparable. Again, you saw a 50% reduction in the development of type 2 diabetes over 3 years. And also, you needed to treat only 6 women with metformin to prevent the onset of 1 case of type 2 diabetes. But as I have spoken to you about in the past, medication doesn't seem to carry a long-lasting effect, whereas lifestyle modification really does have a long-lasting effect for the mother's health. So what we know is that counseling patients to lose weight, to become active, are important steps in preventing the onset of type 2 diabetes in this very high-risk group. I want to thank you all for your attention